Witnessing your child having a head injury can often be a frightening experience. Most parents worry about their children having a brain injury after their children have a head injury. Although head injuries can potentially result in an injury to the brain, most head injuries do not result in serious complications or long-term adverse consequences on the health of your child. It is therefore very important to identify a child who is likely to suffer an injury to the brain, so a referral can be made to the neurology team, including the neurosurgeon. So let us see how to recognize children who are having red flags of brain injury after they sustain a head injury, and then what to do and how to care for them immediately after an event of potential head injury. Most children are likely to report of headache after the head injury event. However, presence of progressively worsening, persistent headache needs to be considered seriously, and a potential head injury and a brain injury need to be ruled out. If your child is having problems in keeping eyes open or appears to be unusually sleepy, this needs to be brought to the attention of your child's doctor. Also, if your child is having difficulty in identifying where they are or getting things muddled up, this also needs to be urgently attended. A child may find it difficult to speak, walk, or may have one-sided body weakness in the presence of a potential brain injury. Further, any history of passage of clear fluids or blood from nostrils or ears also can indicate potential brain damage. Other symptoms that can indicate potential brain injury following a head injury include repeated vomiting episodes after the event, convulsions, new onset deafness in one or both ears, and changes in your child's eyesight. Presence of these red flags need to be communicated urgently to the doctor, and the child needs to be closely monitored for potential brain injury in a hospital setting. Concussion is a temporary, mild brain injury that occurs following a direct blow to the head. Concussion, however, is not associated with any permanent physical damage to the brain. Children with concussion often report of having persistent, mild headache, nausea, and difficulty in concentration and problems with memory. If you are concerned about any of these symptoms, it is important that these symptoms are communicated early to your child's doctor. Most children with mild head injury and with no red flags of a serious brain damage can be managed at home without them need to be hospitalized. However, the parents need clear safety netting advice regarding how to bring their child for medical attention if a necessity arises. There is no need to wake your child up during the night unless you have been advised to do so by a doctor to look for any abnormal and excessive sleepiness. Call an ambulance immediately if you have any difficulty in waking your child up at any time. If your child has any one of the red flags of a serious brain damage, then the doctor will advise to admit the child for further observation. The parameters that are monitored in a hospital setting include things like the level of consciousness, eye signs, heart rate, and the blood pressure. These parameters are likely to be monitored every hour or so for a period up to 24 hours following the event of the head injury. Your child's doctor may also decide to perform a scan called CT scan of the head if there is a strong concern about potential brain injury. And every child who has evidence of a serious brain damage is usually referred to the neurosurgeon without delay for further intervention. Some children with head injury find it difficult to concentrate on tasks which they used to do very comfortably prior to the head injury event. And this is called cognitive fatigue. Being more tearful, anxious, or having problems with memory and sleep are the other features of cognitive fatigue. If your child appears to be different from her or his usual cognitive performance, it is important to bring these symptoms to the attention of your child's doctor. Most children with concussion will make a full recovery. If your child had symptoms of concussion following the head injury, it is important to prevent your child from being exposed to another head injury. Strenuous physical activities are best avoided for the first 48 hours post-concussion and until your child is free from any symptoms of head injury. Sports such as tackling football, basketball, netball, hockey and soccer, and playing on a trampoline and physical activities such as climbing trees are considered high risk and are best avoided during the first few weeks after a head injury. It is important to get adequate amounts of sleep and mental rest to allow your brain to recover. Although paracetamol is recommended for mild persistent headache, agents like ibuprofen are best avoided given the high risk for bleeding. It is important that your child avoid drugs that can make them sleepy. Certain post-head injury symptoms such as anxiety and getting very annoyed easily can adversely affect your child's relationship with family and friends. Therefore, seek advice from the child's doctor if you are concerned in this regard. Children with a concerning head injury often need a graduated return to the school, and it can take up to 4 weeks to completely recover. It is recommended that your child resumes simple daily activities first and then gradually advance to light aerobic exercises such as walking and swimming next. In the absence of any warning signs, your child will be able to resume regular sporting activities subsequently. If your child did not have any signs or symptoms of head injury during the initial observation period, 24 hours after the head injury event, then your child can engage in daily activities as usual and no restriction for activities is needed. It is important to recognize the child with serious head injury from those who have mild or no brain damage following a head injury event. Presence of any of the red flags of head injury warrants immediate medical attention for your child following the head injury. The child with concussion may suffer from the problems of cognitive fatigue, although they will not have any serious brain damage. These children need special attention for gradual resumption of daily activities. However, if your child remains healthy and have no red flags during the first 24 hours after the head injury event, it's generally considered safe to resume the normal activities of daily life, and the child is at least risk for any neurological damage.